I'm Judy Shaw for NYC Floor Talk. Joining me today is Newsha Ghaeli. She is the president and co-founder of Biobot Analytics. Newsha, it's wonderful to have you here. Thanks for joining me today.
Thank you so much for having me.
So Newsha, tell me about your company. What's the mission?
So Biobot Analytics is a wastewater epidemiology company. What that means is that we look for human health markers of disease, markers of what we're consuming, bacteria. We look for these markers in sewage, so in wastewater, because everything that we excrete, everything in our bodies, everything that we eat is excreted in our urine and stool, and it collects in our city sewage. So we're mining that sewage for health data. And then we work with, our customers so we work with state and local government to provide this information to them so that they can make better public health decisions. They can understand the health of their cities at that population level. And then at the highest level, we also work with the CDC to provide a nationwide view of health via our sewer systems. So our vision as a company is that wastewater epidemiology will one day be a permanent infrastructure layer on top of our sewer systems, and our mission is really to generate all of the possible types of data that we can from wastewater.
So now tell me, what impact do you see a coordinated wastewater monitoring program having?
Yeah, so we believe that a coordinated wastewater monitoring program is incredibly important, both for our country, but also globally. So first, if we think of the COVID-19 pandemic, we started monitoring wastewater for the COVID-19 virus at the beginning of the pandemic. It's a very passive, sort of non-invasive way to understand COVID infection in cities. And now with the public health emergency ending, it's actually one of the few sources of data, one of the few sources of truth that we can actually monitor to understand the dynamics of COVID-19 in our communities. And it's one of the few sources of data that the CDC and the White House are going to continue to collect and report on nationally. Second, that same system, if properly coordinated, that same platform can be used to understand and tackle other epidemics, like our growing opioid crisis here in the country. So we also work with local and state governments to monitor for a whole suite of different types of drugs, both licit and illicit, so including fentanyl, methamphetamines, cocaine. And with that information, we can help those local public health agencies actually target and tailor their interventions, their public health interventions, to the acute, issues and challenges that they have locally. And then of course they can share data across different communities and share best practices. And then third, finally, that same coordinated system is now in place, and it'll help us very rapidly respond to emerging threats. So for example, last summer, we very rapidly introduced the analytics capabilities to look for the monkeypox virus. And we very rapidly, through our CDC contract, were able to deploy that across over 400 communities in the US to actually track for monkeypox and be able to provide data back to our federal agencies on outbreaks or spikes that are happening. And we're still doing that work still today.
Okay, so now as you look to the year ahead, tell me, what are you focused on? What are your priorities?
Yeah, so we're focused on really turning our mission and vision into a reality, really making sure that all communities, no matter how small or how big, have access to wastewater epidemiology, have access to this groundbreaking data. We are working to strengthen our relationships both at the local, state, and federal level, expand to other agencies outside the CDC that are interested in other types of health data. And we're also looking internationally. Our intelligence here in the US will only be strengthened if we also have data from London, from Beijing, from Paris. It's very important to know what's going on with respect to human health internationally.
All right, well, Newsha, wonderful to talk with you. Thanks for joining me on Floor Talk.
Thank you for having me.